You're tuning into McLaren Port Huron Hospital Today's Health Program, and I'm in the Emergency Center speaking with board-certified physician Dr. Marc Jones. Dr. Jones, thanks for joining us today.
Thank you for having me.
Could you tell us what sets the Emergency Center at McLaren Port Huron Hospital apart from others in the region?
Yes, we have a full range of services. We have the most experienced staff in the area. We have the most advanced technology in the area. We're set up to handle advanced medical problems, trauma, strokes, heart attack, 24/7.
What makes sense for a patient having stroke or heart attack symptoms to come to McLaren Port Huron Hospital Emergency Center?
Well, aside from being able to handle those, we have advanced transmission capabilities. For instance, if you think you're having a heart attack, EMS is able to do an EKG and send that to us and have us look at it, and we can get started faster on treatment and have possibly treatment standing by. Same thing as far as stroke. If you're having stroke symptoms, they can call ahead and let us know that, and we have a whole stroke protocol that can take care of problems sooner.
Dr. Jones, what makes sense for a patient having heart or stroke symptoms to come to McLaren Port Huron Hospital Emergency Center? Why does it make sense for them to come here?
Well, it really does make sense for them to come here. We have advanced communication abilities with EMS. If you think you're having a heart attack, they can do EKGs, forward those on to us. We can look at them and even call a heart catheterization team in before the patient even arrives. Same thing with stroke. If you think you're having a stroke, they can call us ahead of time. We have a stroke protocol in place that we can get patients treated faster.
Okay. Recently, I know some changes have been implemented in regards to patient flow. Could you explain to us what those changes are?
Yes, recently we've started what's called a fast track system. It's fully staffed with a certified physician assistant as well as a registered nurse. The purpose of that is some of our minor emergencies can get seen faster and taken care of faster rather than waiting behind some of the more serious problems.
Well, how did you go about making those decisions on making those changes, and who do you decide to put in the rapid treatment rooms?
Well, it was really to make the patients happier and more satisfied. So what we decided to do is make some of the more minor emergencies go to that area. Lacerations, ankle sprains, knee sprains, backaches, earaches, coughs, and we are able to see them faster and get them out of the hospital faster also.
What type of patient response are you getting from those rooms?
Patient satisfactions have been great, especially, again, with the time being seen and discharged, as well as keeping the patients informed.
Dr. Jones, thanks so much for sharing this information with us today. Is there anything else you'd like to add in closing?
Yes, if you think you're having an emergency, don't hesitate to call 911. If you think you're having any problems, including heart attack or stroke, McLaren Port Huron is the place to come.
Thank you so much.
Thank you.
Stay tuned. We're going to take a short break, and when we return, we'll be discussing more in regards to why and when you should visit the Emergency Center.